Hi, I'm Dr. Arno Housman, and you've discovered Vital Signs, a public service program sponsored by Phelps Memorial Hospital that takes an in-depth look at medical issues in the news. Today with me I have Dr. Rick Weinstein. Dr. Weinstein is Director of Sports Medicine at the Westchester Orthopedic Institute and for the Bone and Joint Associates. Dr. Weinstein, what makes a sports medicine specialist?
Yeah, most of the people I see are normal, everyday people who just get hurt doing something they shouldn't have done or did too much of something.
What's the most common age range that we're talking about here?
Well, I see everyone from infants, 1 or 2 years old, up till their 90s. Most commonly what I see is people in their 20s to 60s.
Are your patients are coming to you directly, or these are referred patients, or people who are looking specifically for a sports specialist?
At this point, I've been in practice in Westchester for about 13 years. Most of the people I see come from word of mouth, from other patients, from family members, but a fair number, probably 25%, just come from other doctors who know me and what I do.
Well, these days, a lot of patients are finding that it's very difficult to get into the doctor's office. How do you find it these days?
Well, it's interesting. We're very busy, but one of the things we guarantee our patients, and the doctors send us patients, is we'll get people in the same day. And if someone has a fracture, someone has a torn ligament, they want to be seen as soon as possible. My practice, my personal practice, is to get people in the same day when they need to be seen.
Now, do you have a specific sport that you're most expert in, or pretty much all sports are, joints are joints, and we take care of all of them?
I deal with all different parts of the body, so I'll see everything from the ankle up to the neck and back problems. The most common thing I do see is knee and shoulder.
Now, in terms of professional injuries that you see, professional athletes, you are the ringside physician, I understand, for New York State Boxing Commission.
Yes, I'm one of the professional ringside doctors for boxing.
How long have you been doing that?
I've been doing it for about 13 years.
How'd you get into that? It's fascinating.
It was interesting. During my fellowship, I worked with the Hartford Whalers, who are now the Carolina Hurricanes professional hockey team. And the team ophthalmologist invited me to a boxing match at Foxwoods Casino. And I sat ringside and had a great time. The commissioner from Connecticut said we'd love to have an orthopedic doctor because I get a lot of hand injuries and shoulder injuries, and I started doing it in Connecticut. When I moved to New York, the commissioner from New York asked me to join their panel. So now I do fights at Madison Square Garden, and I'm doing a fight June 5th at Yankee Stadium, which will be a lot of fun.
Who's fighting?
Yuri Foreman versus Manny Cotto.
It should be a great fight.
Should be a very good fight.
So I can see the natural progression from hockey to boxing. In terms of boxing injuries,
yes.
You're not a neurologist, but again, we see a lot of neurologic injuries in boxing. In terms of orthopedic injuries that you're seeing and that you have to deal with in boxing, what's the most common?
Well, the most common thing I do see in boxing is cuts, lacerations, so a lot of cuts around the eyes. So I spend a lot of time sewing up people between fights. There's a lot of concussions, as you expect. Orthopedically, I've seen professional boxers who have injured their ankles, and I've seen one boxer who ruptured his bicep muscle in his arm we had to do surgery on. But most part, it's concussions and lacerations, cuts.
Again, for kids, there's been a lot of controversy as to what we should be exposing our kids to and not in terms of trauma to their bodies. The classic example, I think, these days is for pitching injuries and kids and pitching. We start kids very early playing T-ball. It's not pitching, but they're pretty young when they start playing, 4, 5, 6, 7 years of age. They're already playing. Yep. What are the recommendations? Let's start with pitching for one. What are the recommendations? What are the injuries that we're seeing, and how can we prevent those sort of injuries in children?
Well, the most common problem we see in baseball is in the pitchers, and it relates to the number of pitches that they're throwing. So what's very important is counting the number of pitches that are thrown. Oftentimes the coaches will count and they're pretty good about it. However, what's not counted is they were pitching the day before or that they were throwing a lot of warm-up pitches. So say for a 13-year-old, the recommendation may be for 50 pitches in a game. That has to include the warm-up pitches as well. So you can't have the kid throw 20 pitches warm-up and then throw 50 additional ones because he's thrown 70 pitches.
So absolutely never should one person pitch a whole game?
Unless they're a phenomenal pitcher and they can limit it to the specific numbers, I wouldn't anticipate someone at the youth age pitching a whole game.
So we did that calculation before. The minimum number of pitches What was the number that we came up with?
Well, if you're talking about a 9-inning game and a perfect game where every pitch is a strike and an out, you'd pitch, I think we said 81 pitches.
So nobody, not even professional people, should be pitching, a perfect game.
Well, they all should be perfect. Pitching a perfect game would be great, especially the Yankees. It would be very nice if they did that more often. But it's very infrequent that happens, and with bad pitches and fouls and outs, even in a perfect game, you're going to pitch more than 100 pitches.
Once you've injured yourself, what's the next thing to do? You say, ouch, that hurts.
Well, what you want to know is what's wrong with you. So the important thing is to make a diagnosis first. So if someone hurts the knee, they twisted it, it's probably a mild sprain. You ice it, give it 2 or 3 days. If it's not better, get it checked. Go see a sports specialist, let them take a look at it. I see a lot of people in my office, 50 years old, 60 years old, even 70-year-olds, who've seen a medical doctor or a chiropractor, and they just say, you have arthritis, and I'll get an x-ray, and that's the only way to really confirm arthritis is on an x-ray. I'll get the x-ray, and they don't have arthritis, and guess what? They have a meniscus tear. Try physical therapy, they don't get better, I'll do an arthroscopy. And this is a surgery I do that takes about 10 minutes, in and out of the hospital the same day, and people are back to playing tennis, back to golf, back to full activities.
Again, the key is diagnose the problem. If it's something that may eventually require surgery, that's no guarantee. By doing exercises, you can protect the joint and maybe even correct the problem.
Yes.
Is there a role for things like chondroitin and what's that other stuff?
There's chondroitin and glucosamine.
And glucosamine, right. Chondroitin and glucosamine.
There's been a couple of really good studies looking at chondroitin and glucosamine. And they've shown that they do help about 50% of people, and they're very safe. So I do tell people if they have arthritis, you can try it, but it will take 2 months till you know if it works.
So that's the key. It takes 2 months to kick in and have the effect that you wish it to have.
Right.
But if it works, it's great.
Absolutely.
And the indications for that, who should be taking that?
First, get diagnosed with arthritis. Don't just assume you have arthritis, you have knee pain and swelling. And then I like to try anti-inflammatories, Advil and Motrin, Celebrex, try these medicines. If they don't work, glucosamine is a good alternative.
Well, once again, we're coming to the end of a show. We've covered a lot of material. I think that the take-home messages are, number one, if you injure yourself acutely, ice.
Yes.
Number two, if it goes on for more than a couple of days, seek some counsel and find out what's going on.
Correct.
The number three, just because you have an injury doesn't mean that you need an operation.
Correct.
That there's quite a bit that can be done, especially physical therapy. That you can avoid the problems by warming up before you exercise and by doing muscle building exercises to protect those joints.
And good stretching.
And good stretching.
Yes.
That the surgery is good. As you pointed out, you can do it arthroscopically through small incisions.
Yep.
What's the recovery time for something like that?
For a knee arthroscopy, people are back to full activities, full sports, usually in 6 to 8 weeks. So it's very quick.
And again, don't assume that you have arthritis, without fully, evaluating the situation.
Right.
One, so you can protect yourself from further injuries in the future, and two, so
Right.
you can stay active.
Right.
Anyway, thanks again for watching. I hope you've picked up some pointers here. If you have any questions further, you can refer to the number at the bottom of the screen to get Dr. Weinstein's phone number, and you can get, as you can hear, he'll see you in 24 hours. If you have a problem, give him a buzz. We do have at Phelps a fairly good physical therapy department, and I think that the key is to stay active. In this day and age, we're active until our 90s and beyond, if you're lucky enough to get there. So I wish you all healthy activities, and feel free to call anytime. Thanks for watching.